Hi everyone, welcome back to the channel. This is your fave nurse Anne, and today I am doing a solo video with me, myself, and I. And this video is going to give you 5 tips before going into nursing school. And these tips aren't just for nursing school. I am just saying that because I'm a nurse and that's what I know. But these tips can be generally for any profession that you want to go into. So whether it's post-bachelor's degree and you want to get your master's in OT, PT, or any of sort, or even if you're like just graduating high school and you're deciding what to go into, these tips will benefit you as well. So my first tip, uno, is be nice to everyone. And I know it's like an easy tip before going into nursing school or just going into healthcare in general, but this is really important because you have to learn how to care for everyone, not just one specific group. So this may include minorities. This includes people with substance use disorder, alcohol use disorder, any mental illness. These people also may be your patients, or they are going to be your patients. You know what I mean? So you have to really be nice to everyone, and whatever stigma you have going into nursing school, you're gonna have to let go of that because you have to care for everyone and be in a way that it is nice and pure and compassionate. You really have to love caring for all. Care for all people, no matter what skin color you are, religion, whatever background you come from, you have to care for everyone. And that is like the easiest thing, but a lot of people don't think about it. And they're just, well, I'm a nurse because I just want to, stabilize the patient or give them their meds and do that. But sometimes you have to, not sometimes, all the time you have to interact with the patient. So if they disclose information to you that may be tough, you have to learn how to use motivational interviewing. You're going to have to learn how to talk to them, listen to their needs. Because, you might be like, oh, I want to just be inpatient and I'm not really into the psych thing. But listen, if you're in the ED, and the patient comes in and they're all bruised up, they have, they have some open wounds and it looks like they got into a fight, and then they disclose to you that, they were raped. You're gonna be that first person that they tell that to. Yes, you can call the social worker, the case manager, all those people, police, all these people can get involved, but you're gonna have to interact with that person first. And if they disclose that information to you, what are you gonna do? How are you going to de-escalate them? How are you going to talk to them? How are you going to do a lot of these communication skills that you're gonna have to utilize? It's not just, oh, I'm stabilizing the patient, I'm saving this patient, I'm doing that. It's more to it. You're using not only things you are born with, being nice and compassionate, but you also skills we can teach you, skills you're learning in your facility, skills you're going to be learning in nursing school. But being a good person, being nice, that comes within. And if you're not, then unfortunately this may not be the right field for you. So that is tip number 1. Tip number 2. Tip number 2 is to really be interested in the human body. You really have to really want to know what is going on. Keeping up with the latest thing, evidence-based practice. You really have to be hungry to learn more. Don't just be stuck. You've been doing this for 10 years and you know how it goes. You think you know everything. You don't. No one ever knows everything. Okay, that's just straight up. So don't be afraid to ask. Even now, as you are, going into nursing school, or you're going into PT school, or you're going into any field, or you're just a student, you're trying to figure it out, ask. Ask. If you don't know, just ask, or Google, or research, or do something. Don't just sit there not knowing. There's so many resources out there. Ask. That's all you have to do. If you don't know, the scariest thing is for you to be in a field and you stopped learning. You just stop. And that is when you start putting your patients at risk, because you're not keeping up with what's the newest evidence-based practice to help your patient. You really have to be hungry to learn what is the latest thing. What can I be doing better? What can I be doing better as a provider? What I can be doing better as a clinician? You always have to want to be better. And that's just in general too. That's just not, it's not whether like in your career, but just as a person, you always want to be better. You always want to do better. Be interested in learning, how can I be a better clinician? How can I be a better nurse? How can I be a better PT? How can I do better? Ask yourself these questions and go seek it. If you're questioning something, ask someone that is more experienced than you. Ask someone that, that does something different. Be interested to learn and ask the patient. I'm a fan of asking the patient. I always tell them, like, you guys are teaching me. You know what I mean? I can learn something in the textbook and I see something completely different in person. Ask the patient, like, okay, so what is that like? Tell me. Be interested, be hungry to learn about the human body. Like, you know what I mean? Like, just be interested. Always have that fire to learn. I think that is like the most beautiful thing about any field or any nursing. Like, you always know when nurses are interested and they always want to learn more. Like, they're always like, oh, I didn't know that. Tell me more. It's like, oh, I can tell you. And if I don't know, but can you tell me? Like, there's no such thing as a stupid question. All right, there isn't. Just ask. That's all you could do, ask. All right, moving on to tip number 3. So tip number 3 is it's somewhat like tip number 2, but it's kind of expanding from it. So tip number 3, and this is for nursing specifically, is to really have a strong anatomy and physiology background. And having that strong anatomy and physiology really helps you understand what is going wrong with the body. So you know what's going right. Like, for instance, the heart, how it pumps, it goes from the right atrium, left atrium, all these different mechanisms. But when you start, when it's like, oh, the heart is pumping another way, that's when you know something's wrong. You know what I mean? Because the right. It'll put you at such an advantage if you really have a strong anatomy and physiology background going into nursing school. And that I'm talking to the people that are post-bachelor's and they're going back to get their accelerated degree. For high school students that are going into nursing school, try to take anatomy and physiology while you're in high school. And if your school doesn't provide that, try to be really strong in the sciences. I think having a strong science background really helps you understand what's going wrong with the body. It's like, because nursing really, it's like, there's a lot of things to nursing, but being able to pick up on things that are wrong will really help you. Like, you don't have to diagnose a patient. That's not your job. Like, that's the doctor's job, or the primary, or the NP or the PA job. That's their job. Your job is to figure out what's going wrong. You might have like an idea, like, I really think this person is having heart failure, like, but you can't diagnose. You can just tell them, this is what's going on, that's what's going on, this is what I think, this is what I recommend, but they make the diagnosis. You just have to know what's wrong, and that's it. So having a really good anatomy and physiology background will put you like 10 steps ahead of the game. You're like, oh, I know how the heart works. I know how the brain works. I know how the lungs work. And then now you just have to learn what's wrong, and it puts you such in a great advantage. I will tell you, my friends, like, this is like the one thing to like surviving nursing school, like having a strong anatomy and physiology background. Like, I remember I had to really go back. I had to go back. I was like, all right, before I start learning about what's going wrong, let me revise what's the correct function. Let me revise what am I supposed to be seeing before I even go to what I'm not supposed to be seeing. And that will help you survive nursing school, like, tremendously. All right, moving on to tip number 4. So tip number 4 is to be open to all specialties. I know sometimes we go into school and we're like, I want to be an ED nurse. I want to be an ICU nurse. I want to do this. I want to do that. listen, you might change specialties. Like, that's just the reality of it. You know, something might be seem really cool before going into nursing school, and then you're like, no, this is where I belong. Like, that's cool. That's interesting. But this specialty or this population is where my heart belongs. And that that happened to me. Like, I used to be a ED technician, like a ED tech. And I worked with in the emergency room, stabilized patients. It was like this rush. I was like, oh, this is so cool. And then I did my public health clinical, and I worked with people with chronic illnesses, with HIV, with substance use disorder, alcohol use disorder. And I worked with those patients. And that's where my heart belonged. I was like, this is where I belong. I belong with helping individuals that, you know, people overlook and people aren't taking care of them correctly, or where they feel like healthcare failed them. This is where I belong. Yeah, that ED stuff is cool and all, and it's always going to be cool, but my heart was to those patients. And that's what I'm working with, that population now. Just be open. Don't just tell yourself, oh yeah, like even it might be like the thing that you've never even looked at. You're like, oh, I never even thought that I would like it. And then you end up loving it. Just be open, because the minute you start closing yourself and you have that tunnel vision and you're just like, this is what I want to do. It's like years later, you're like, oh, I never knew I could be that type of nurse. And that's moving on to my like second point too, within this fourth tip. It's like, you don't only have to work in the hospital. You can work so many places while being a nurse. Like, you can work in clinics. You can work on a van, like that's like a clinic, which is kind of cool to me. And that's like more community health. You can work with in schools and being a school nurse. You can work in like just different locations and settings. It's not just, or visiting nurse, where you're more caring for preventative, you're doing more preventative medicine. Like, you're keeping the patients away from the hospital. You know what I mean? Like, and then there's always inpatient too, and they have specialties like ICU, which is like intensive care unit, like when those patients are really sick. And then you have also like med surge. You also have the ED, radiology. There's so many different like units in the hospital. So it's like, just be open about it. Just be, and that's going back to, you know, tip number 2 is just be hungry to learn, because you don't know where your path is. You might have this thing like, you know what, I'm doing this, but listen, things happen and you find out what you love and you find out where you're meant to be, and you just be open. All right. Moving on to tip number 5. Tip number 5 is to put yourself out there. And what I mean is, go volunteer, ask a friend, do whatever you need to do to put yourself out there in order to know what's out there. You know, I didn't know I wanted to be a nurse until I worked in a setting with many nurses. I didn't know that. I always told myself I didn't want to be a nurse. And then look at me now, a nurse. But put yourself out there. You don't know what's out there. Like, ask people. If you're like, I want to be a physical therapist, and your neighbor's a physical therapist, ask him his job, and maybe you can shadow him or her. You know, like, if you're like, you know, I want to do this, don't be afraid to ask. The worst thing that they can say is, no, I don't have time. I have a lot of patience. And maybe they can refer you to someone else that has time and the patience for it. Like, you know what I mean? Like, don't just sit there and like, just not do anything. Just put yourself out there. You know, you don't know what's out there until you are there. And that is like my biggest thing. I always encourage people, please ask questions. You're littling yourself, you're limiting yourself when you don't ask questions, when you don't go out there and learn, and just put yourself in that field. I always tell people, start off as being a PCA or CNA in a hospital or in a clinic or wherever, and then see where that goes sometimes. be a MA, a medical assistant, or even if you want to start as, the care coordinator, like the unit coordinator, if you want to start as there, just kind of seeing how the dynamics are in the hospital, start somewhere and then just grow. Start somewhere and just grow. Do I need to repeat that one more time? Start somewhere and then just grow. Keep leveling up. Don't ever stop working on yourself. Don't ever stop working on being the better version of you. And these are my 5 tips. I hope you guys enjoyed the video. Please like, subscribe, and please comment and let me know what you think of it. If you have any other suggestions on what I should talk about, please let me know. Enlighten me, tell me, or ask me questions too. Tell me. If you're interested in what I do, ask, and I can tell you guys what I do. But have a great day, and bye.